Hey, good evening, everyone. My name is Taryn Vielma. I'm a science educator with the Health Museum here in Houston, Texas. And we are joined by the Texas Liver Foundation. And then tonight's conversation is about pediatric liver transplant. And we have some survivors with us that are going to talk to us and ask some questions with some of the surgeons. And what we're doing is we're allowing everyone to kind of come into the call. And I'm going to turn it over to Dr. Peace DK in just a second. So we're going to let some people come in. We'll give it a couple more seconds here, and then I'm going to pass it off to Dr. DK. The sound you hear in the background is my dog. All right, Dr. DK, I'm going to turn it over to you to get us started.
Perfect. Well, thank you, everyone, and welcome to tonight's event. And on behalf of the Texas Liver Foundation and the Houston Health Museum, I'd like to welcome you to our monthly event that's called Conversations with Liver Experts. The mission of the Texas Liver Foundation is to inform Texans about their liver health and liver diseases, improve their quality of life and outcomes through education, advocacy, and partnership. Before we get started, I would like to thank Taryn and those at the Houston Health Museum for providing this platform and sharing in our vision for bringing you this event tonight. Tonight is one that's going to be a celebratory event. It's going to include an expert panel of our transplant surgeons, as well as an expert panel of our pediatric liver transplant recipients. I want to start off by first introducing Dr. Goss and Dr. Galvan. So a few words about Dr. John Goss. He is the JLH Foundation Chair in Transplant Surgery at Texas Children's Hospital and professor at Baylor College of Medicine. He's a national leader in a number of pediatric liver transplants performed, and his group has led the country in pediatric liver transplant volume. On a professional note, he is internationally known for his surgical techniques. And on a more personal note, he is unwavering and he's definitely an advocate for children with liver diseases and often takes on very complex cases that other institutions cannot. He's incredibly well-loved by many children and parents and serves his community and has a great bedside manner. Dr. Galvan is one of our other abdominal, pediatric, and adult liver transplant surgery doctors that works at Texas Children's and is also an assistant professor at Baylor College of Medicine. She completed her medical degree and received a master's of public health from Emory. And she also has been innovative in a lot of different areas within the hospital, instituting a number of different types of innovative collaborations and multidisciplinary expertises, as well as publishing a number of works on clinical outcomes. And she also currently serves as a health policy scholar at Baylor College of Medicine. And so in addition to that, we have our pediatric transplant liver recipients, which I'll let them introduce themselves as we get started with our program. For those of you who are in the audience, we have a chat box that's open. So please feel free to leave all your questions and any question that you have for either the surgeons or the pediatric patients who are here, please leave those and we will answer them towards the end of our talk. So we'll get started from here. Thank you.
Hello, everyone. My name is Lucero. I'm 13 years old. I'm in 8th grade, and my liver transplant was October 26th. Some things I like to do are I like to go outside with my dog and take him on walks. And my question for Dr. Galvan and Dr. Goss are, what are some challenges after a transplant?
What are some challenges after a transplant? Well, I think there can be a number of challenges after the transplant. I think part of it is
learning how to take care of yourself after a transplant, learning how to take care of your medicines, learning how to, be able to go to school with your medicines and interact with everyone else. I know sometimes if there's cold and flu season, you have to be probably more careful than some of your friends. And some of those things are hard for you because you may feel a little bit different sometimes. So I think that really making sure that you understand that you're not really that different. You just have to, take care for yourself is really one of the biggest challenges that you'll have. But in the end, your life can be just like everybody else's. We expect you to go to school. We expect you to go off to college, have a family, and be productive, just like everybody else, So you just have to, accept that you are normal and you can do everything, and just then go ahead and do it.
Thank you.
My name is Cooper, and I'm in 5th grade, and I have 2 amazing teachers. And why did you choose to become a surgeon and specialize in the liver?
Okay. I actually went into medical school thinking I would go into primary care. Statistically, most doctors become primary specialists. But for me, I just couldn't stop thinking about surgery. I just enjoyed it. A 30-hour day in surgery felt shorter than an 8-hour day on neurology, to be honest with you. And then once I realized I wanted to go into surgery, I learned more about what I could do and what is available. And I liked the technical demands of transplantation. I did think about cardiovascular surgery and heart surgery, but you have to choose the people you want to work with. And Dr. Goss was quite the leader, and he really can't operate. And I wanted to learn from him.
Mm-hmm. Thank you.
Thank you.
Hi, my name is Crystal. Hi, my name is Crystal. I'm in 3rd grade. I'm 8 years old. And I'm gonna be turning 9. I have a brother and a sister, and those things I like to do is sing and dance. I have a question. Okay. What is your favorite part of working at a transplant surgery?
What's your favorite part?
Were you able to hear?
Yes, we can hear you. Yes.
Oh, okay.
I don't know what Dr. Galvan's favorite part is, but my favorite part is finishing it. So we know that we've because there's lots of steps. There's you have to get the patient listed for transplant. We then have to get an organ offer for the patient. We then have to go get that liver and bring it back, and then we have to actually do the transplant. So I really think that my favorite part of it is finishing it, because it shows that all the other steps have taken place, and we're now at the point where we really wanted to be, and that was to give the child or to give the parents or the family a chance to have a transplant.
And since you like music, you'll be happy to know that when we get to the end, Dr. Goss likes to change the music because it's just like a little celebration.
Do you like Britney Spears?
He does.
Oh, really?
Yeah. See? You need a lot of Britney all the time. Except during Christmas, you can have Christmas music, a little Mariah.
He likes Mariah too, yeah.
Oh, yes.
I like Selena Gomez, so you'll hear a lot of Selena Gomez.
Mine is my favorite ¿cómo se dice? Artist of the music of Mexico. It's it's Angela Aguilar.
No, she likes a Hispanic singer, and her name is Angela Aguilar.
Oh,
Okay.
We'll
Yeah.
play her next, okay? We'll play her in this case coming up,
Okay.
okay?
Okay, thank you.
Yeah, thank you.
I have another question. How many people are in the OR when you're doing a transplant, and who are they?
Go ahead.
Okay, so you have 2 surgeons at least, sometimes 3 if it's a very challenging case. And then you'll have usually a resident, someone who's learning to be a surgeon. Sometimes 2, we'll have medical students who are learning to be doctors. And then you'll have your scrub nurse, who's very essential. She learns the surgeries and gives us the instruments that we need in order to do the surgery well. You'll have an anesthesiologist and oftentimes a fellow who's learning to do a complex anesthesiology as well. And then we'll have circulating nurses, often 1, sometimes 2. Again, if things are critical, then we'll have more nurses. And I would say that's the bare minimum, but sometimes when things get hectic, there's a lot more.
Yeah. And sometimes in bigger patients, larger children or whatever, we may have a perfusionist or some kind of thing like that. So, there's always a large number of people that are there for your transplant. So it takes a village to make it all happen.
Thank you.
How many transplants have you performed?
No, they don't care how many I have.
No, if you take, when I finished my fellowship in 1997, which none of you were alive in 1997, Tao was.
I was alive.
But the rest of you weren't. But since 1997, I've done almost 3,100 transplants. And since we moved here to Houston, we've done almost 700 children, pediatric transplants. And since Tao's finished her fellowship, Tao has scrubbed on probably 90% of all the pediatric cases that we've done since she finished, or really probably since she started her fellowship.
Mm-hmm.
So a large number of the pediatric cases are myself and Tao. In fact, the majority of all the pediatric cases are Tao and myself. So, but it takes a lot of experience and a lot of time to be good at it. So one of the things as you guys go along, there are some books that you probably need to read and some people that you probably need to follow. And there's one, it's called Outliers, whatever, but the author of that book also tells you about other ways and why some people succeed and why some people fail. And you should probably look those kinds of things up because you're not going to be really, really good at something if you only do it once in a while. You have to do it a lot to be really good at it. And then there's some other principles you kind of have to think about to be really good at things as well. So if you kind of look him up, it might be entertaining. You might like it, give you something to think about.
Also, one other thing that I think Dr. Goss teaches us really well is that we have to look up the Admiral. The Admiral says there are 10 rules you have to live by. He's a Marine.
Navy SEAL.
Navy SEAL. There's 10 rules that he learned during his SEAL training. And if you look him up, it was in 2017.
Yeah, so 2014, I think, was when he gave the University of Texas undergrad commencement address.
William McCraven.
Yeah, so get the 10 rules. Tao has to recite them every morning when she gets up. The 10 rules for the day.
The first rule, it's easy. The first rule is you got to make your bed. Okay, they're very easy rules, but you just got to keep doing them. And failure is part of success. So even though to get good at something, you have to fail. So just accept that. And once you accept it and get over it, you get there,
Yep. Absolutely. What else? Any other questions? Are there some on the chat there?
How young was your smallest transplant patient?
So we've done a transplant on a baby that was 2.8 kilograms, or right about 5.5 pounds to 6 pounds. And we've done a transplant on a baby that was 21 days old. So those are the smallest ones and the youngest ones that we've done. What's interesting is that sometimes those cases are in fact easier than some of the biliary atresia cases and things like that are in there that are 2 to 3 years of age, and for sure a lot easier than a biliary atresia who makes it to say 25 years of age. Those patients are very difficult to do, but we can do small babies and children. The hardest thing though is finding a liver that will fit into those.
So Dr.
children.
Goss, Elise is asking, how do you fit an adult liver in a baby?
Yeah, so what we have to do is we have to cut a piece of that adult liver off to put it into the baby. So Dr. Galvan did this two days ago, something like that. 2 days ago, we needed a liver for a child that was quite small, 7 or 8 months of age. And so we had a bigger liver from a 6-year-old, and Dr. Galvan took the right side of it off. We didn't use it. We put the left side of it into the much smaller patient because that left side would fit. So that's what we have to do, and it can be done. It adds a larger complexity to the operation because you not only have to operate on the recipient, but you have to operate on the donor liver as well. So it's more complex, takes more time, takes more expertise, but it can for sure be done.
There's a question here that I think is good for you guys to help answer for our families. The question is, if someone is worried about having a transplant, how can you talk about how you dealt with it? And we'll leave it for that, and then we'll talk to you about what we would say. When you were scared, what did you do? How did you feel?
I always thought about looking at the outcome and how much happier I'll be with a new liver, being able to do more stuff that I couldn't do before. Because before I couldn't play sports, and now in a couple of months I'll be able to play sports again, be able to run around more. So I always like to look at the outcome.
I think for Cooper was only 16 months when he had his transplant. So for him, he wasn't really scared. It was his mom and dad and his family that were really scared. And so I think for us, what we did too is we actually talked to Dr. Goss before he was in surgery, and he told us the exact same thing that he's saying now, is that, you know, you're going to be so surprised at how happy he is and what kind of life he's going to be able to lead. And when he's 11 years old, he'll be able to play football and he'll be able to do all these things. And that was super hopeful for us to hear him say that, and then to, you know, taking care of him after the transplant and seeing him get better and better every day, and then not looking at him. So trust what the doctors are telling you, but also gotta have a lot of faith and hope in that outcome.
Yeah, Crystal was she was a baby as well. She was 7 months old. So it was you know, the family and the parents, us, we were the ones that, you know, pretty scared about the situation. I guess one advice that I would give is take it day by day. Don't overthink it. Don't think, you know, don't overwhelm yourself with what might happen. It, you know, just take it day by day. You know, I never saw myself, you know, we're going to be 80 years out of transplant. If you look at her, you can, you know, people don't even notice that everything that she went through, you know, so it all pays off. You know, you get scared because you're going to have to do this and that, you know, a lot of new things. You're going to have to adjust your life, but it's going to be like your new life, and you get so used to it that it's like, you know, I have other kids that are not sick, and it's the same. You adjust to it, and it's your new life, but it's worth it.
I have another question. Why and when do you decide not to take an organ from a donor?
When we fly out to these donors, part of it is looking at size. A lot of our children are very small. And so that's why you'll find me or one of our partners come like in the middle of the night. A lot of parents are sleeping, but we come with a ruler and we actually measure the patient to make sure that when we fly off and go to the donor, we'll remember the size that we're looking for. And so size is a big deal as far as pediatric transplants go. Quality is another one. If there's anything concerning, we screen all our patients so we have an idea of how the quality of it all, making sure there are no other diseases we have to worry about, or liver disease. Some of our donors are very young themselves, and so they might have undiagnosed liver diseases. So these are all the things that we have to think about. And when we actually go to the donor surgery, we have to also assess and make sure that the anatomy looks good and is appropriate, the vessels are of good size, and that there's nothing untoward or unexpected that we need to be worried about. But really, size and quality, once you're there, you're looking at size and quality.
Yeah. Well, there's a question on how long a liver transplant takes. Now, I'm going to make sure nobody's behind us so they can't hear this, and don't tell anyone this, because everybody thinks it takes 8, 10, 12 hours. And so they pay us like that. But it only takes about 4 hours. Don't tell anybody though, okay? Actual surgery time is for maybe 5 hours, but our bosses think it takes all day.
A lot of the time too, the anesthesiologists are putting you to sleep, putting the central line in and all those extra stuff. And so that pads the time at the beginning and the end for parents.
How does it feel when you see someone like me who is 10 years old post-transplant that you performed?
Well, I think that it's the best part of it. Okay, your parents have heard this, but you don't remember it. But we don't do transplants for the short-term benefit only, right? The goal is that if you get your transplant, you're going to grow up to be 85 like everybody else in America, right? So we want to see you grow, and we want to see you achieve, and we want to see you mature and move on to the next step. So seeing you guys go off to kindergarten is one thing, and then you go to Little League or Brownies or musicals or whatever you're into. We like to see that growth and development, because that's really why we do this. Is one, to save someone's life, but also is to give you quality of life. And the operation and the transplant itself is a very big deal, but all the management afterwards is also a big deal. And with doing all that, then we're allowed, we have the ability to see you grow up and advance towards adulthood. And that's what is the most important thing, I think, for the satisfaction that I get from this. Let's see, what else can we tell you guys about? There's some more questions that were sent in. Let me find them here. Let me see if I can find one. Do we live close to the hospital? Both Dr. Galvan and I do live close to the hospital. It's convenient, and we travel at sometimes not very opportune times. Like, we're going to start a transplant here as soon as we finish this, and then by the time we get home, it's going to be 10 or 10:30, 11, whatever. So you don't want to be driving all the way to Fulshire or something like that, in the middle of the night and stuff. So we do in fact live close to the hospital. Yes.
I have one. Who has better outcomes, adults or children?
Well, go ahead.
I think if you look at the survival, right, the children generally do better, but they have longer to live. So I don't know if it's a fair comparison to say, but I think generally speaking, the children get better quality organs. And if they do well after transplant, they live a very long time. That's assuming they take their medications. There's a period in time in the teenage years where you just don't want to take your medicines. And that's probably the worst thing you could do for your transplant. So if we could convey anything, it's just please make sure you stay faithful to your medications. In fact, there was a question that asked, is there a point where you don't have to take your medicines anymore? And for a small percentage of transplant patients, that is true, right, Dr. Goss?
Yeah.
But it's a very small percentage.
Yeah. Every now and then there'll be a study or a trial, and sometimes we can enter patients in that trial, and you can get a few patients off the immunosuppression. But in general, you just have to assume that you're always going to have a few medications. May not be as many as when your parents first took you home after your transplant, a whole handful of them that they had to take care of and get you to take. But even when you're an adult, you're probably going to have a few of them to take every day. Yep.
What does the long-term care for transplant recipients look like? Well, the first year is a lot of doctor's visits, a lot of blood draws, a lot of, sometimes, a lot. Yeah, sometimes you have to come back to the hospital. But after the first year, I think things kind of taper down. Your medicines are start to minimize to the bare bones, and your doctor's visits get fewer and fewer because you've become stable enough where we just have to check on you a couple times, once a year, at the very least. And so I think that long-term care is easier than the first year. The first year is a lot of heavy duty work lifting, but yes, yes, but it will get better. I will say, this time next year, things will just start drifting off. So it'll be good. It'll be good.
Yeah. There's always some sort of care. And it's one of those things, as long as you take care of the liver, it's going to take care of you. So there's always some sort, but after the first year, it really calms down. I mean, you may only get labs if everything's going well. You may only have to even get laboratories drawn 4-5 times in a year, as long as your medicines are all taken and your levels are good and things like that. So long-term can be a lot easier, but that first year is an adjustment for everybody.
For your body, right? So that's why we have to be so careful and diligent about it. Now, Dr. Goss has a good answer for this one. Can you explain how cool the liver is? Dr. Goss will say there are only 2 organs you actually need to live.
Yes, there are only 2 organs that you really need. You need your brain and your liver. Everything else we have machines for. So there's a ventilator for the lungs. There's pumps for the heart. We can get dialysis for the kidney. Yeah, blood transfusions for the bone marrow and stuff like that. But there's no replacement for your liver or your brain. So obviously the coolest organ in the body is your liver. And
actually he knows both the brain and liver because he started off as a neurosurgeon. He didn't like it, so then he went into transplant. So he knows both organs very well. Okay, now what is it that makes it so that you can be off the medications? Really, it's just making sure that you don't reject. And so when we take you off the medications, we have to make sure that your liver numbers aren't going up and that there are concerning signs. So that's why it's hard, because a lot of people, when you take them off meds, the liver numbers start rising because your body is starting to reject your organ. But it's a conversation worth having. I would say that it doesn't happen until later in life, like maybe into adulthood. And what is the hardest complication to deal with when you do a transplant? I will say that as far as transplants go, bleeding is very, very significant. And sometimes, for example, patients who have to have a redo liver transplant, bleeding is almost such that you can't be successful. The other one is just infections. I think some infections get so bad that we run out of medications to treat them. So it's important for us to just try and be very mindful about the infections that we have surrounding us. And I think for a lot of you, it's very unique because you're living in a time where infections is all that anyone's thinking about. So I know it can be a little disarming, but as Dr. Goss said, as long as you can be adaptable, you'll be okay. Just make sure you're taking care of yourself and your body and your liver. And we'll do everything possible to make sure that continues to be true. We support you through that, because ultimately we want to see you survive long before we're gone, or long after we're gone. It sounds Dr. Goss had to go start the case, so I'm sorry about that. Is there any other final questions that we can answer really quickly?
I have a question.
Yes.
Who does the transplant where you're sick or have personal
Commitments.
Oh, I see. Well, I think that's part of what makes transplant kind of challenging for a lot of surgeons, is because the schedule is a bit demanding. So we try and, you asked about how far away we live. There are things that we do in our lives to make it such that it lends itself to being a good transplant surgeon. So part of being a good transplant surgeon is trying to be available as much as possible. I have a family, and Dr. Goss has a family that they're very supportive of us. Like my sons, they know that mommy has to go to work. And it used to be challenging for him to know that I had to go to work. But once he understood that I was helping babies, then he didn't mind it anymore. And so I think that when you just recognize the good and the bad of things, the goal is to give you guys this wonderful, wonderful, long life. And so if that means that, you're not home for dinner a couple nights. As long as your family understands, then I think it's okay. And my family is incredibly supportive. They know that if I'm happy at work, I'm also happy at home, and everyone thrives. And so really our goal is, it's not a balance. It's a tapestry, right? It works together. And so I don't think of work and home life as opposite things. They're continuous. And so some days I have to be at home and some days I don't. But most of the time I can be at work if necessary. And so we just balance it out. We just work together and make sure that if I have to be somewhere, or if I'm ill, someone is there to cover. That's why we have a team of surgeons. In fact, Dr. O'Mahony used to do all the surgeries with Dr. Goss. And in fact, probably for Cooper, Dr. O'Mahony was the one who was assisting Dr. Goss. But time's passed, and so now I do more of the assistance, and we do these transplants together.
Do you perform any surgeries outside of Houston or Texas?
We do our procurement surgeries throughout the country. Yeah, so I'll fly wherever it takes. In fact, Dr. Cotton's coming back from Dallas with an organ. So we fly a lot of places and perform those surgeries in different places.
Who is your favorite superhero and why?
Superhero? Batman. I've always loved Batman. Why? I think it's because he had something bad happen to him, and he's trying to deal with it by producing good in the world. As long as you cannot overcome your challenges and be greater, then I think that's laudable. And he wasn't born with it, like Superman, it's like so easy. You're just like born with it.
Have you experienced any failures? If so, what have you learned from them?
Failures. The most important thing I learned from failures is that just because I have a failure doesn't mean I'm a failure. And I think distracting the two it took me a long time to appreciate that. So if I could convey that to any of you guys, it's like, you need to fail to win. You need to fail to get good. And so I tell my boys, if you fall down 7 times, you get up 8. And I really believe that as long as you learn your lesson, you have to learn what it is that made you fail and try and prevent it from happening again. If you learn your lesson and evolve in a way that you get better and better, then I think failures are helpful. Now, if the failures make you spiral into nothingness, then it's not good, right? But the point is just to know that failures will happen, sadness will happen, and you'll have to rebound from it. But if you can, then you will be successful. You just got to push through.
All right, this one might be a little hard for Crystal to read. She's bilingual, and she's barely learning English. But one of her questions was like, what experiences or life lessons do you or have you taken away from being a surgeon?
Mm-hmm. Well, from being a surgeon, actually what's hardest is not learning surgery, but teaching surgery. And that's still something I'm working on. Being able to communicate everything that I've learned over the years is actually more challenging than I realized, but it is very joyful because then you see those residents and surgeons in training, that you see them grow and you see their skill set evolve. And it's very important because, me training them, they're going to be your surgeons in the future. So it's important that we pass on the knowledge. Like Dr. Goss has probably done the most liver transplants in the world. And I would say that he's been very generous in sharing his knowledge with me. And so I have to keep in mind that I must do that for others, but I just have to learn to do it well, right? To communicate and convey this knowledge in a way that people were willing to receive it.
When you pick up a recipient's donated organ, what has been your favorite mode of transportation?
Oh, I like it when it's down the street or it's very local. Flying in a jet is fun initially, but over time you realize it takes a lot of time away from being near your family and whatnot. So my favorite mode of transportation is just walking down the street to get to do the procurement and walking it back. What's your favorite mode of transport?
Driving my car.
One of these questions was what kind of car you drive. What kind of car do you drive, Dr. Goss?
It's a BMW. Yeah. So
I drive an Audi.
What do you like to do for fun?
For fun.
For fun, I like to hang out with my family. I like to see my kids and my wife, hang out with them.
I'm the same way. I really just love spending time at home and being with my kids. I just love playing with the kids.
If you didn't become a doctor or a surgeon, what career would you choose?
I would be a marine biologist. I love the ocean animals.
I would be a wildlife biologist because I want to know how a goose can fly from the tundra in Canada all the way to Mexico, lay their eggs, hatch the little goslings, get them to grow up so they can fly, and then fly them back to Canada. And their head's only like that big, and their brain's like that. So how can they go, thousands of miles, know exactly where to go, stay out of the cold, raise their babies, and go right back? Huh? Don't you think that's pretty cool? I mean, there's cool stuff out there when you think about it, you know? So, and that's what I wanted to do, but that's too hard to get a job doing that. I'm not that smart. There are too many other smart guys trying to figure out the goose, and so I have to work with Dr. Galvan.
My favorite food, Elise, is pomegranate. I love pomegranate. Pommies. What's your favorite food?
My favorite food is pizza.
Fridays are pizza days. What else? What other questions can we answer for you guys?
What do you guys have a pet?
I do. I have a dog. She's 12 years old, and my dog's name is Bunny.
Well, I have to tell you, we had a dog, Bailey Sue, and she was a Bouvier, but she got old and started having bad arthritis and stuff, so we had to have her put to sleep. So she's not here anymore. So no pets right now for me.
She died?
Yeah, unfortunately.
Okay.
Where did you go to college?
I went to Emory in Atlanta. I grew up in Atlanta, Georgia. So I went to Emory.
So because I like the goose and everything, I went to the University of Wyoming. I know your mom's laughing at me. They think there's something wrong with me because I went to Wyoming, but there's nothing wrong, really. It's okay. It's all right.
You turned out okay.
Have you had any memorable surgeries since you became a surgeon?
Memorable?
Yeah, memorable.
You know what's really weird is I have to tell you, the things you remember the most are the times that you didn't achieve what you wanted. Okay, so I can tell you we do lots of transplants and we do lots of other surgery as well. We do liver tumors. Tao also does kidney transplants, and we do lots of operations. The ones that you remember, unfortunately, are the times when everything doesn't go perfect. So, I have to tell you, if your operation goes well and we don't remember you, it's great, right? Because the only time we remember is if it haunts you that something wasn't actually perfect. And that's really, unfortunately, the most memorable times you have as you grow through this, you know?
Yeah, it haunts you. I think that's a fair statement. But I also like to remember the major saves. Like, when you don't think a patient will make it off the table and they do.
Well, I mean, we remember things like we just recently had a baby sent to us from Alabama that they couldn't take care of. And the child had a lot of problems and truly was a day or two from dying. And we were able to get a liver and the baby goes home.
Yeah.
He's going to go back to Alabama. They're going to have to watch Alabama football, but whatever. But they're going to go back to Alabama with their family. And that's memorable as well. So some of the things that are really kind of extravagant, you do remember those as well. But you know what? I think you have to realize that transplantation is a team sport. It involves, us, the surgeons. Then you see Dr. Dika and Dr. Harpavath and people like that, maybe Dr. Leong, whoever your hepatologist is. But there's an entire team of people to make everything happen. So yeah, we remember the surgeries and all, but I think the other thing we also remember is that to get to one of these spots where maybe we got to take care of someone that otherwise other centers couldn't take care of, is that there's a whole team that's involved with all these machines and meds and everything else they do to try to keep the patient going until we can finally get a transplant. And then we have the anesthesiologist that have to support us in the operating room, and the nurses, and then the coordinators afterwards, which you guys are very familiar with your coordinator. In fact, that's probably who you talk to and interact with more now than any doctors or whatever. So I think it's there is stuff that's memorable for us, but we also have to keep in mind that it is an entire team of people that make this happen for the patients.
We have a question here from Elise. Do you like to tell your kids about the transplants you do?
So my own children, well, I don't know how Tal's going to answer that, but I hope that my son does what I do. He's a medical student right now. He's come and watched us do a few transplants. Hopefully next year he'll be a senior student. He'll rotate on our service. And then I hope he does his residency here and takes over and works for Dr. Galvan once I'm gone.
For me, my son, my 4-year-old, he likes to count. So he doesn't ask so much about the transplant so much as how many patients do I have. So if I tell him 25, he's like, oh, that's a lot. But if I say 1 or 2, he's like, oh, that's easy. So that's about as much as I say to him. I really just, I don't want to stress him out either. I just want to say, we just have one baby who needs a little bit of care, and then I'll be home. And then that's it.
How many hours of sleep do you get each night?
Well, it kind of depends on the night. Some nights you don't get very much. But in general, I have to tell you, I think that about 6 hours is a good night.
Yeah.
Yeah.
But some nights you don't get much. That's okay. It is what it is.
But I think that another thing, and you guys are all old enough now to be learning these things. If you read about some of the very successful people, Warren Buffett, people like that, they don't spend a lot of time sleeping. You need.
No, you guys need
some.
sleep.
You need some.
Us.
But you can't sleep all day and all night.
No, you need sleep to develop your brain.
Warren Buffett doesn't sleep.
Warren Buffett sleeps. He sleeps.
He's in Omaha. What else can you do?
Anything else, guys?
What's your favorite color?
What's your favorite color?
I think it's navy blue.
Okay.
Mine too.
That's great.
I'm green blue, like the ocean.
Okay.
What's your favorite color?
Mine, I have like 3 favorite colors.
Okay.
It's pink, yellow, and purple.
Oh, those are lovely. That's a lovely color combination.
Yeah.
Are you on call all the time?
Tal and I take call a lot, but that doesn't mean that you don't have a life. That means that you value the time that you have, irrespective of what the activity is. You value the time you have. So, when I'm on call and I come in to do a transplant with Tal or whoever, I love that time. First of all, we get to help take care of a patient. And one of the best things about transplant surgery is you actually get to cure a disease. So if you have biliary atresia, if you have a metabolic disease, if you have whatever, doing the transplant, we can end that disease for you. Now you have to take care of yourself, you have to take your medicines and all those kinds of things, but we're able to do that. So I value that time. It's not work. It's a very great gift and privilege that we have to help take care of the patients and their families. So we are on call, and I value that call time. At the same time point, if we don't have a transplant, I go to dinner with my family. I go exercise with my kids. I go do whatever I want to do, and you have to value that time. The worst thing you can do is sit around and mope if you don't have the time that you want for something. You have to make the best of the time you have and realize what's good about it and make it even better.
Yeah, I mean, I have a PA friend, Sarah Lands, who takes care of a lot of our adults. She told me once, and it stuck with me, the best time in your life is right now, and the best place you could be is right here. And so I think that's a really good way of looking at things. You just make the very best of what you have.
What's your favorite,
All right.
what's your favorite holiday and why?
You want to go first, Tom?
No.
My favorite holiday, I'd have to say, is Christmas. I like the whole family thing. Even though my children are 26 and 28, they are always here with us for Christmas. My wife demands it. They are not allowed to bring any girlfriends or anything because there's only one woman in the house, and that's her. But I like Christmas because of the whole family thing. Yes.
I like Thanksgiving because the presents stress me out. Like just having to get presents for everyone is very stressful for me. But I like Thanksgiving because everyone still comes together and we eat and we enjoy each other's company, but without the presents.
Okay, so I got a question on my phone about favorite snack foods and soda. And so I have to tell you that, again, you can't tell anybody about this. It's kind of like how long it takes to do a transplant, but you can't tell anyone. But the greatest things in the world, Mountain Dew and hot tamales. That's it right there. That's all you need for life. Well, a little bit of pizza on the side.
Do you remember patients like Elise?
Yes. Yeah, I remember Elise Babbitt. That was a long time ago, though. Elise Babbitt's a long time out from her transplant.
But I have to say, like experiences like these, we see you when you're sick. We see you when you're very sick. And then even after transplant, you're still very sick. You're tired, you're sore. But when I get a chance to see you, even if it's in passing in clinic or in this situation, I mean, it is just like incredible. It's incredible. It's almost like you're different people sometimes. And that's very nice to see. It's very nice to see you thriving.
Oh, Sarah Kamara just reminded me that every now and then you might have to have a mega stuffed Oreo too. Yeah, Sarah's right. There's nothing wrong with a good mega stuff. Let's see, what else? What else can we tell you guys? Should we look for more questions off the question list here? Is there anything we didn't answer yet, you guys?
What does a normal day at work look like for you?
What does a normal day look like for us?
Oh, you tell me.
Well, it looks kind of like this, honestly. You round on the patients in the morning, and then you have a transplant sometime around then. Sometimes it's meetings like this, and sometimes it's writing papers and doing research and making connections. Hopefully a lot of it is more surgery than meetings, but some days it's more meetings than surgery, unfortunately.
Yeah.
Sometimes Dr. Gossel asks me to find a liver so he can get out of meetings.
Yes, we like to avoid meetings if possible. We're not very good meeting doctors. We're better operating doctors.
Oh, Elise says, have you ever been to the transplant games? I haven't, but I've been wanting to. And then when I started, when I was growing up, I had a family friend whose mom was a she was on the lung transplant wait list. And then she finally got her lungs. And then she was at the transplant games and she won so many gold medals. So I've been wanting to, but to be honest with you, I haven't. I don't know if Dr. Goss has.
Well, I have been to the transplant games when I was here in Houston, but I have another secret for you guys. If you, and you can use this one as you want, but in our group, and I don't know, some of you may know this person very well, but we have one of the probably most decorated transplant game participants ever, because one of your coordinators donated a kidney to her dad. And so she's able to participate in the transplant games, and she can run like a deer.
Oh my gosh.
And there is
so
nobody that
fast.
can keep up with her. So in your own group, you have a transplant game star.
She let me borrow her shoes once, and I felt faster just wearing her shoes. I said, "What is this?" Everyone knows. Everyone knows who it is.
That is great.
What's your favorite way or place to vacation?
Oh, okay. I'm going to get a little bit adult on you here, and I'll tell you why. So first of all, you have 5 senses: sight, touch, smell, hearing, and taste. So my favorite place to vacation is because it is my favorite smell in the world. And that's Banff, Canada. And then you go above it and it's Lake Louise. And the reason I like that is the air is so clean and it smells completely different than what we ever have here, right? And in the big city. So I really like it because it's just a satisfaction to know that the way it smells and the way that, it is, it's just so much different and so much nicer than what we have in the big city.
I personally like vacationing somewhere I haven't ever been before. I like trying to go to different places all around the globe if possible.
Oh, and I'm glad that the Babins are going to Lake Louise. Yeah, you have to stay at the chateau, at the lodge there, and see the Victorian Glacier and everything. It's great. You'll love it.
Well, great. Any other questions that any of you all have, or any other questions in the chat? No? Okay, well, thank you, Dr. Goss. Thank you, Dr. Galvan. Thank you, all of you, for just being a part of this panel and just enlighten us all with everything, and just we really appreciate it. So if there's no more questions, if it's okay with you all, I wanted to just close out the session. And again, thank the Health Museum for this platform. But thank you and happy holidays.
Thank you all.
All right, thank you.
Thank you.
Okay, bye.
So nice. Thank
Bye,
you.
thanks.
Bye.
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 Have a puppy.